At the Republican convention, the Republicans continue their lies about Barack Obama. This time it's about Barack Obama's health care plans. Let's take a look at what they said.
John also understands that health care costs are budget busters for way too many American families. He'll provide help, but he'll put patients and their doctors in charge, not the federal government.
We can't have a health care system run by doctors and patients instead of a federal bureaucracy.
See, whenever you hear Republicans talk about Obama's health care plan, they just get it wrong. Barack Obama does not want one government health care system. If you currently have health insurance right now, the only difference is that your plan might cost a little less because of a tax break. If you currently have a health care plan, like I do, that allows you to choose your own doctor, Barack Obama's plan will not change that. Your health care decisions will remain between you, your doctor, and your current health insurance provider as dictated by your plan. What Barack Obama's plan will do is provide health care to those people who are lacking it already. It will allow them to participate in a plan that is similar to the current plan congressmen have. It will not require you to get on some sort of government-run plan, and it will not change the way you have your health care provided to you by your current health care plan that is provided by your work or that you pay for yourself. And of course, you're going to hear the typical, my money should not go to pay for someone else's health care, that's socialist, argument by the right. Well, here's a news flash. If you pay for health care currently, your money is already providing health care for people who cannot afford to pay it for themselves. See, hospitals cannot reject people in the case of an emergency. So people without a health care plan will let their conditions get to a point where they become an emergency. They don't pay, and the hospital passes off those costs to you and me, the people with health insurance. We either pay for that out of our own pocket, or we pay for it via higher insurance premiums. Now, if it costs $50,000 to provide emergency care, but it would only have cost $5,000 to provide preventive care, wouldn't a fiscal conservative choose the plan that takes less money out of your pocket? And if in either way we have to pay our share of it, the obvious choice of which option is more fiscally responsible is the preventive care option. So, the next time you hear someone complaining about Barack Obama and how he will give us a healthcare system like Canada that has enormous lines or waits, or that he would create some huge government bureaucracy that interferes with your ability to plan your specific health care needs with your current doctor, you can tell them to stop listening to the Republican lies, to actually go read Obama's plan for themselves and to not get their information from pundits alone, and to consider which option, emergency care or preventive care, actually takes less money from their pockets and is the more fiscally responsible. At the end of the day, an honest fiscal conservative will have to admit that with the laws as they are and how emergency rooms cannot turn away people in the case of an emergency, that the preventive care option will actually take less money out of their pockets.